You know that feeling, 3 in the morning, dead asleep, and suddenly your calf seizes like someone's twisting it in a vice. You kick the sheets off, gritting your teeth, waiting for it to pass. Or maybe it's the cold. Your feet feel like 2 blocks of ice shoved into socks no matter how many blankets you pile on. Your legs ache after a short walk to the mailbox. They feel heavy, swollen, like they belong to someone 20 years older than you. Now, what if I told you there's a single natural oil that's been used for centuries, backed by modern research, that may help warm those feet, ease those cramps, and get blood flowing through your legs again? And most people over 60 have never even heard of it. Stay with me, because in the next few minutes, I'm going to show you exactly what this oil is, how it works inside your blood vessels, and the simple ways you can start using it tonight. Let's talk about what's actually happening in your legs. After age 60, your circulatory system doesn't work the way it used to. Your arteries stiffen, the walls thicken, blood moves slower, especially to the parts of your body farthest from your heart, your feet, your calves, your toes. Doctors call this peripheral circulation, and it's basically how well blood reaches your extremities and makes the return trip back up. When that circulation weakens, you feel it. Cold feet that won't warm up. Nighttime leg cramps that jolt you awake. A heaviness in your lower legs after standing or sitting too long. Tingling, numbness, skin that looks pale or slightly blue around the ankles. More than 40% of adults over 65 experience some degree of reduced leg circulation. 40%. That's nearly half. And many people assume it's just aging, just something you live with. But here's the truth. Poor leg circulation isn't just uncomfortable. It's a warning. It means your tissues aren't getting enough oxygen. Your muscles aren't flushing out waste properly, and over time, it can lead to serious complications, slow healing wounds, blood clots, even tissue damage. So anything that safely supports better blood flow to your legs, that deserves your attention. The oil I'm talking about is cayenne pepper oil. Specifically, oil infused with capsaicin, the active compound found in cayenne peppers. Now, before you think, peppers for my legs? Hear me out. This isn't about eating spicy food, though that has its own benefits. This is about a concentrated, warming oil that interacts directly with your blood vessels when applied to the skin or taken in small therapeutic amounts. Capsaicin has been studied extensively. Published research in journals like the European Journal of Pharmacology and the British Journal of Clinical Pharmacology has shown that capsaicin dilates blood vessels. It literally tells them to relax and open wider. When vessels open, blood flows more freely. More blood reaches your calves, your feet, your toes. Think of it like a garden hose with a kink in it. Capsaicin helps straighten that kink. The water, your blood, rushes through, and it does something else remarkable. It triggers the release of a molecule called nitric oxide inside your vessel walls. Nitric oxide is your body's natural vasodilator. It's the same compound that pharmaceutical drugs try to mimic. But here, your body produces it on its own, nudged gently by the capsaicin. Let me break this down plainly. No medical degree needed. Your blood vessels have a thin inner lining called the endothelium. Picture it like wallpaper inside a pipe. When capsaicin reaches that lining, either through your bloodstream after ingestion or through your skin when applied topically, it activates something called the TRPV1 receptor. Don't worry about the name. Just know this. When that receptor gets triggered, it sends a signal that says, relax. The smooth muscle around your blood vessel loosens. The vessel widens. Blood rushes in. That's why people feel warmth almost immediately when they apply cayenne-infused oil to their legs. It's not just a surface sensation. It's actual increased blood flow beneath the skin. And here's what matters for cramps specifically. When blood flows better, your muscles receive more oxygen and more magnesium and potassium from your bloodstream. Those are the exact minerals your muscles need to contract and release properly. Starve them of blood and they seize up. Feed them properly and they stay calm. Heavy legs, same principle. That heaviness often comes from blood pooling in your lower extremities because your veins aren't pushing it back up efficiently. Capsaicin's warming effect stimulates local circulation, helping your body move that stagnant blood upward. So, how do you actually use this? The most direct method for leg circulation is topical application. You can find cayenne-infused oils at health food stores, or you can make your own by steeping dried cayenne pepper in a carrier oil like olive oil or coconut oil for 2 to 3 weeks. Here's a simple nightly routine that many seniors have found helpful. First, warm a small amount of the oil between your palms. About a teaspoon is enough for both lower legs. Start at your ankles and massage upward toward your knees using firm, steady strokes. Always move upward. You're encouraging blood to flow back toward your heart. Spend about 3 to 5 minutes per leg. Pay extra attention to your calves and the arches of your feet. You'll notice warmth spreading within the first minute or two. That warmth is circulating. After massaging, put on a pair of cotton socks and loose pajama pants. The fabric holds the warmth in and lets the oil absorb over several hours. One important note: always test a small patch of skin first. Apply a tiny drop to your inner wrist and wait 15 minutes. Capsaicin can cause a tingling or mild burning sensation. For most people, it's pleasant and warming, but if your skin turns red and stays irritated, dilute the oil further with more carrier oil, or try a lower concentration product. Never apply cayenne oil to broken skin, open wounds, or varicose veins that are inflamed or tender to the touch. And always wash your hands thoroughly after application. You do not want capsaicin anywhere near your eyes. Beyond topical application, taking cayenne internally offers systemic circulatory benefits. The simplest method: add a quarter teaspoon of cayenne pepper powder to a glass of warm water with a squeeze of lemon and a half teaspoon of honey. Drink it in the morning before breakfast. Start with a small pinch if you're not used to spice and gradually increase over a week or two. This morning tonic does several things simultaneously. It raises your core temperature slightly, which improves peripheral blood flow. It stimulates your metabolism, and it supports healthy blood viscosity, meaning it may help keep your blood from becoming too thick and sluggish. Some seniors prefer cayenne capsules, which you can find at any pharmacy or supplement aisle. Look for capsules containing between 30,000 and 50,000 Scoville heat units. Take one capsule with a full meal to avoid stomach irritation. Dr. John Christopher, a well-known naturopathic practitioner, spent decades recommending cayenne for circulation. He documented cases of elderly patients whose cold extremities warmed noticeably within days of consistent cayenne use. While anecdotal, his observations align with what modern studies confirm about capsaicin's vasodilatory effects. If you're over 60, or if you're caring for an elderly parent or loved one who complains about cold feet, nighttime cramps, or legs that feel like lead weights, this information could genuinely change their comfort and quality of life. Sometimes the simplest remedies are the ones hiding in plain sight. Go ahead and hit that subscribe button right now so you don't miss our upcoming videos on natural circulation support and leg health for seniors. And if anything I've said so far sounds familiar to your own experience, drop a comment below. Tell me, do you get cold feet at night? Do cramps wake you up? I read every single comment, and your story might help someone else watching. Cayenne oil works well on its own, but combine it with a few simple daily habits and you amplify the results significantly. Elevation. Twice a day, lie on your back and prop your legs up on 2 pillows for 10 to 15 minutes. Gravity alone helps drain pooled blood from your lower legs. Do this after your morning cayenne tonic and again before bed after your oil massage. The combination of internal and external support with elevation creates a powerful 3-pronged approach. Ankle pumps. While your legs are elevated, flex your feet up and down slowly. Point your toes toward the ceiling, then push them away from you. 20 repetitions. This contracts your calf muscles, which act as a natural pump squeezing blood upward through your veins. Vascular surgeons call this the calf muscle pump, and it's one of the most effective free tools you have. Hydration. Dehydrated blood is thick blood. Thick blood moves slowly. Many seniors don't drink enough water because their thirst signals diminish with age. Aim for 6 to 8 glasses daily. If plain water bores you, add cucumber slices or a splash of cranberry juice. Compression socks. Wearing graduated compression socks during the day, especially if you sit for long periods, keeps blood from pooling. Apply your cayenne oil at night when the socks come off. The alternation between daytime compression and nighttime warming massage gives your circulation support around the clock. I want to be straightforward with you here. Cayenne oil is a wonderful supportive remedy, but it is not a replacement for medical evaluation if you're experiencing serious symptoms. See your doctor if you notice any of the following: leg pain that occurs every time you walk a certain distance and stops when you rest. This pattern, called intermittent claudication, may indicate peripheral artery disease, which requires proper diagnosis. Skin on your lower legs or feet that changes color dramatically, turning dark purple, deep red, or developing brownish patches near the ankles. Wounds or sores on your feet or legs that don't heal within 2 to 3 weeks. Sudden swelling in one leg accompanied by warmth and tenderness. This could signal a blood clot and needs immediate attention. Numbness that doesn't resolve or that spreads progressively upward. Cayenne oil supports circulation beautifully as a daily wellness practice. But these warning signs suggest something deeper that needs professional imaging and evaluation. Don't ignore them. Catching vascular problems early makes an enormous difference in outcomes. Not all cayenne oils are equal. Here's what to look for when purchasing. Check the capsaicin concentration. For topical use, products listing between 0.025 and 0.075% capsaicin are ideal for seniors. Higher concentrations exist but can cause excessive burning on mature, thinner skin. Look at the carrier oil. Olive oil, sweet almond oil, and jojoba oil all absorb well and nourish aging skin simultaneously. Avoid products with artificial fragrances or chemical preservatives. Your skin doesn't need that. If you're making your own at home, use dried cayenne flakes or powder from a reputable spice supplier. Combine 2 tablespoons of cayenne with 1 cup of carrier oil in a clean glass jar. Seal it tightly and store it in a cool, dark cabinet for 14 days, shaking gently once daily. After 2 weeks, strain through cheesecloth into a dark glass bottle. Label it with the date. It stays potent for about 6 months. Some people blend cayenne with other circulation-friendly ingredients: ginger root, black pepper, or rosemary essential oil. These additions complement capsaicin's warming properties and add their own mild vasodilatory effects. A few drops of rosemary essential oil in your cayenne blend creates something that smells like an herbal apothecary and feels like liquid warmth spreading through tired muscles. Let me set honest expectations so you're not disappointed. Some people feel noticeable warmth in their feet on the very first night of application. That immediate warmth really increases blood flow, and it's encouraging. But lasting circulatory improvement, the kind where cramps become less frequent, heaviness fades, and your feet stay warmer throughout the day, takes consistency. Most people report meaningful changes after 2 to 4 weeks of daily use. Your blood vessels need time to respond to regular capsaicin exposure. Think of it like exercise. One walk doesn't transform your fitness, but 30 days of daily walks absolutely does. Keep a simple log if you like. Note your cramp frequency each week. Rate your foot coldness on a scale of 1 to 10 each morning. After a month, look back. Patterns emerge that you might not notice day to day. And remember, circulation is a whole body system. Cayenne oil is one powerful piece, but pairing it with gentle movement, proper hydration, good nutrition, and elevation creates cumulative support that your vascular system responds to gratefully. Let's bring this together. Poor leg circulation after 60 is incredibly common, but it is not something you simply accept. Cold feet, nighttime cramps, heavy legs, these are signals your body is sending, asking for support. Cayenne pepper oil, rich in capsaicin, dilates blood vessels, triggers nitric oxide release, and brings warm, oxygen-rich blood flooding back into your lower extreme 130 itties. applied topically through gentle nightly massage or taken internally as a morning tonic. It offers a natural, affordable, time-tested way to support the circulation your legs are craving. Combine it with elevation, ankle pumps, hydration, and compression during the day. Watch for warning signs that need a doctor's evaluation. Be consistent, be patient, and track your progress. Your legs carried you through 6 decades of life. They deserve this care. If this video helped you understand what's happening in your legs and gave you something practical to try tonight, hit that like button. It tells me to keep making content like this for you. Subscribe to this channel and tap the bell icon. We publish new senior health videos every week, covering everything from joint pain to heart health to sleep quality. Share this video with your spouse, your sibling, your neighbor who always complains about cold feet. Sometimes the people who need this information most aren't the ones searching for it. And leave me a comment below. Tell me, what's your biggest leg circulation complaint? Cold feet? Cramps? Heaviness? I want to hear from you, and your comment helps other viewers feel less alone in what they're experiencing. Take care of yourself. You're worth it. I'll see you in the next one.